Hi, I'm Dr. Trace Curry, and welcome to our gastric balloon removal instruction slideshow. Now let's talk about removal of your balloon. I do want to point out that your balloon must come out after 6 months. It's not acceptable to leave it in beyond that. The risk of rupture of the balloon goes up significantly after 6 months due to the fact that gastric acid is very caustic, so with time it will erode away the surface of the balloon, which could lead to rupture. As we mentioned earlier, the reshaped balloon does have blue dye in it, so if there were any kind of leak or rupture of the balloon, which is very rare, you would know this immediately because you would have blue urine from absorption of this dye. So if this were to happen, please let us know immediately. Proper preparation for removal of your balloon is critical. We need to make sure there's no solid food in the stomach at the time of the procedure. If there is a lot of solid food in there, we may have to cancel and reschedule the procedure, which would result in additional cost to you. The first thing to do to prepare for removal of your balloon is to take the Reglan that we prescribed during your insertion. So you're going to start this 48 hours prior to removal of your balloon. Take 3 tablets a day of Reglan. Also, no solid food for at least 48 hours prior to removal, puree or liquids only. During this 48 hours, it's helpful to have frequent sips of Diet Coke, Coke Zero, or Diet Pepsi because these acidic colas will help clean the surface of the balloon to make it easier to get out. And then, of course, as always, nothing to eat or drink after midnight prior to the procedure. The removal itself takes 20 to 30 minutes. You'll have sedation. Typically, rarely we have to do general anesthesia, but usually we do sedation just like the insertion. So you should be able to go back to work the next day because you won't have the nausea and vomiting that you had after the insertion. After removal of the balloon, the program continues for 6 months. You'll continue to have monthly dietitian visits. We can do virtual visits or phone visits if you live far away from our offices. I do want to bring up the option of weight loss medications. We have a lot of experience with the medications that are approved for long-term weight management. So we can utilize this for patients after the balloon is out to not only help keep the weight off that you lost already, but lose additional weight during the second 6 months of the program. I do want to point out that these types of visits would require being seen by a physician in addition to a dietitian, so they are $50 per visit extra. So that covers everything you need to know about insertion and removal of your gastric balloon. If you have any questions for us, you can see all of our contact info on the screen. Please feel free to email me or email our schedulers or dietitians or call them if you have any questions at all, because we want to make sure you're fully prepared for your gastric balloon to ensure that you have optimal success. Thanks for listening.